Hi, I'm Dr. Carolee Johnson with Quantum Techniques, the most cutting-edge healing system in the world. Today I wanted to discuss healing your teeth. There are a lot of times when there are chronic infections in the body, and that can be a focal infection feeding from the teeth. Root canals can cause a lot of problems in other areas of the body that we don't even realize. I've seen root canals cause chronic arthritis, chronic kidney infections, chronic sinus infections, and a lot of different things, and so it's important that we take really good care of our teeth. I found out recently that I had holes in my teeth myself, my cavities, and even an infection under a tooth. There was no root canal, but it was causing problems for me, and so I did a lot of research to see what would help those to heal, and I have found a program that works for me, and we can test each person because their deficiency may be a little bit different, and so with Quantum Techniques we can test each product for each person and see just what it is that they need to rebuild those teeth, and then of course adjust their diet accordingly as well. I did have to change my diet, take out a lot of the fruit and sweets and different things that reverse the fluids that flow through the microtubules, because once that fluid is reversed, then it allows bacteria to pull into those, and even that heavy, the strong covering on the teeth, the enamel, actually has little tiny microtubules that allow fluid to flow from inside the tooth to the surface of the tooth, and if that becomes reversed by eating something that's not working for you, or a lot of times fruit will do it, sugar will do it every time. Even if sugar doesn't touch the teeth and it just goes, if you were to take it and just pipe it straight into your stomach, it still reverses that fluid in your teeth and will start to cause that bacteria to go back in the other way and start to dissolve the microtubules and eventually cause holes in your teeth. So anyway, what I've been doing, and these holes are actually filling in for me, is I created a program. I can't do shell and rock type minerals for calcium for me. I had to do calcium precursors and bone meal type calciums because that's what worked for me. We can test every person and just see what works best for you. So for me, the first thing I did was I took magnesium and boron because that's one of the things that helps calcium to move into the teeth and the bones. My choice, and this may not be your choice, but I like the 20 meal team borax. I know, I get it in the laundry detergent aisle, but if you aren't comfortable with this, then there is also pharmaceutical grade borax or boron available on Amazon.com and Vitacost and other websites, or maybe your health food store will carry that. I chose borax because it's just easier for me and I like it. And magnesium, I just use the magnesium chloride because magnesium can be a real stool softener, and I didn't want to go that route, and so magnesium chloride seems to work the best for me. And what I do is I take 1 teaspoon of borax and 1 teaspoon of magnesium chloride flakes, and I just put that into a quart jar of water, and I just shake that up, and I take 2 tablespoons of that water every day as part of my nutritional program to strengthen and heal my teeth. So there's that. I also do oil pulling. I also use this to brush with a little bit of spearmint oil. That's my toothpaste. It doesn't scratch my teeth. It strengthens and heals them, and you can also add a little tea tree oil or something like that that tastes good for you if you want to be more antibacterial with your toothpaste. Oil pulling, you just take a tablespoon of that oil, swish it through your teeth for 5 minutes. I do it for 10, but I have to do 2 separate tablespoons of oil because I don't like that much oil in my mouth for 10 whole minutes. So I just separate it into 2 segments of 5 minutes. That's really helpful to pull bacteria out of your teeth and out of your gums. It helps to strengthen your gums. Brushing strengthens your gums. It also helps get the calculi out from under the gums, which cause the gums to come away from the teeth, helping to strengthen and heal the gum tissue so that you don't have pyorrhea or anything like that. Another thing that I have found really helpful with under the tooth infections is to make a concoction of MMS. And anybody that is introduced to natural healing probably knows these products. You have the MMS solution and then the activator solution. And to make this part of my tooth healing protocol, I take 5 drops of the MMS solution and I put that into a glass. And then I take 5 drops of the activator solution and put that into the same glass. And then I let that activate, and it starts to smell a little bit like chlorine. It turns yellow. And then I add 2 ounces of pure spring water. And after the spring water is added, then I will add 5 drops of DMSO. And the reason that I add the DMSO, that's this product here. I get that on Amazon.com actually. It's the 99.9% pharmaceutical grade. And the reason that I add this is because that will pull that MMS right into the enamel of the teeth, and those microtubules that can get bacteria in them, it clears that. It can go through the gums and get into that root, hopefully to the bone if you need it. And if it's bad enough, you can also double that and wet a clean white washcloth and just set that over the area that's infected. And so that will go through the skin tissues, which are very permeable, and into that area of infection. And I've also done that with a lot of success in my own case. And then the supplement program that I do that has helped me, and we may have to test everybody because they're different, but the foundation of it is, number 1, I do some kind of aloe vera because that is natural stem cell activation, helping the teeth to regenerate. This particular one is called Aloe Fusion. It's concentration of the allantoin, which is a cell proliferant, activating stem cells and helping or causing that everything to heal faster. I think aloe vera speeds up the healing process by 10 times, according to what I understand in my studies. The next thing I do is I have a good D3 supplement, and you can test, muscle testing, to find out how much you need. I do 10,000 a day for my 5'2", almost 5'3" frame, and everybody may be different. You may not need as much. Some people need more, depending on your metabolism, your system. I do a K2 supplement. The one that I chose has an MK4 and MK7 in it. It's called Decalcify. That's the one that I use myself. And I take one of those a day for on my weight in my frame. I do a vegetal silica. This one is springtime horsetail because it's a calcium precursor. And everybody's calcium needs will be different depending on their pH balance usually. I also do Mincol, which is a calcium precursor. Mincol, if you can see that one. The other thing that I do is I do iodine. This happens to be a Lugol solution. It has humic and fulvic acid involved in that so that it goes right into the cell. Iodine is necessary for the rebuilding of the teeth. There's a lot of different iodines. Some people are bad on iodine and they can't do it, in which case they may not even need it. For me, I needed it, and it's been really helpful for me. I do a good fish oil to help rebuild my teeth. Because the EFAs, the essential fatty acids, are also essential for rebuilding the bones in the teeth. And the other things that I also include myself are a good biotin supplement just for the collagen factor of rebuilding those gums and the roots and the different tissues that are involved with the teeth, and a good natural vital protein supplement. This is also helps to rebuild the collagen. I have found that to be very successful in my own case, and hopefully this will help you too. If you're having problems with teeth, tooth infections, tooth meridians that are feeding another focal infection, we can test any chronic infection and find out, are your teeth feeding that? Is there a root canal that's the problem? Personally, I've never seen a breast cancer without a root canal. And so, checking those teeth and rebuilding those teeth, your tooth health is completely essential to the health of the entire body. So if you have trouble with your teeth, call me, or if you have trouble with anything that has to do with this, give me a call. There's a lot that I can do. Carolee at quantumtechniques.com, or the Quantum Techniques website is just www.quantumtechniques.com. Have a great day.